Client education is just our biggest thing. That's honestly one of the main reasons I have been in this field for as long as I have. I thoroughly enjoy educating clients, spending that time with them, especially if it's their first pet. So we always have our routine of discussing vaccines, the schedule, preventative care, heartworm prevention, and their vaccine schedule. So the clients always know when they're coming back, and they stay educated.
If we really think about their just basic activity level, going up and down stairs, even just engaging with the owner, things like that are definitely things that we can see. Dogs, I think, jumping up in and out of the car, up and down our furniture, wanting to go for walks, how long do they want to go on walks, that sort of a thing are all different things we can see at home where we can notice that there might be some discomfort there. Then we have a lab who's going to run and do all the things no matter how much pain they're in. So I mean, again, sometimes we don't see a lot at home, but until it's really progressed, but there's definitely signs that we can notice. Thinking we have a few smaller dogs that have torn their cruciate ligaments at a much older age recently. And so, you know, surgery is risky for a lot of patients, but especially in our older patients, and our smaller breed dogs are going to tend to do better without surgery if we can't do surgery. So, you know, we've been using laser with joint supplements and anti-inflammatories as appropriate, and we've seen some really positive responses with that for sure. Other big thing that I think is important is watching patients, you know, in environment modification that we can do to help support them, using rugs, helping them with stairs, ramps, that sort of a thing. And also, you know, watching their diet and weight is a huge factor with joint disease as well. So doing that prophylactically, but also managing it when they're having some issues and not going to be as active as they can be.
Yeah, so I've noticed, I was actually just talking about this the other day, that especially like here in this clinic, I've seen more like 14, 15, 16-year-old dogs than I've ever seen in my entire life. So they're definitely living longer. And I think it's just a testament to the kind of medicine that we have access to now, and then also the clients willing to obviously spend the time and money to put into the products. So it's really kind of, you know, it's just like with human medicine, they're always coming up with new things and pushing things forward. It's just like in human medicine. So the access to increasingly good products that are safe and, you know, work well, and then the clients listening and really taking to heart the recommendations we have. I'd say those are the two biggest things that are kind of contributing right now.
So I have a lot of empathy for just a little bit of decrease in mobility. Our animals don't necessarily show pain as drastically, or they can't even really communicate it to us. So we need to really ask our clients and really be observant of what's happening with that dog. And also our physical exams are just so important. We can pick up little tiny changes in joint swelling and joint diffusion, or educate owners about weight shifting, or little things that they can just monitor at home so that they know, hey, maybe it's time to start a joint supplement. Maybe this is when we want to start some Regensa. Yeah, a lot of empathy for changes from small things to big things.